Most people who live with chronic physical pain have heard some version of the same sentence. The tests are normal. We cannot find anything wrong. And for a while, that is supposed to be good news. But for the person living inside that body, the one who wakes up every morning with tightness in their chest, or an ache that moves through their shoulders and neck and lower back without any clear origin, being told that nothing is wrong is not a relief. It is a particular kind of loneliness. What medicine has been slow to name, neuroscience is now making undeniable. Grief that is not processed does not disappear. It does not resolve on its own with time. It encodes itself into the body, into the tissues, the fascia, the nervous system, and it eventually speaks the only language the body has left when the mind has been too long in silence. It speaks as pain. Dr. Bessel van der Kolk at Boston University has spent over 3 decades mapping what happens inside the body when loss is not given room to move through. Using brain imaging technology, his team demonstrated that unresolved emotional trauma activates the same neural circuits as physical injury. The brain does not distinguish between a broken bone and a broken attachment. Both register as damage. Both demand a response. And when that emotional damage is suppressed, when grief is rushed, minimized, or simply never spoken aloud, the body takes on the task of holding it. The regions most affected are consistent across studies. The throat tightens, the chest contracts. The stomach carries a persistent low-grade tension. The shoulders rise and stay risen. The lower back, which researchers have linked to feelings of unsupported burden, becomes a site of chronic inflammation. These are not imagined symptoms. Inflammatory cytokines, measurable molecules in the bloodstream, are elevated in individuals carrying prolonged, unresolved grief, just as they are in individuals with active infection or tissue injury. Dr. John Sarno at New York University documented thousands of cases in which chronic back pain, fibromyalgia, and persistent tension headaches resolved not through surgery or medication, but through the patient finally acknowledging and expressing the emotional content the body had been storing. His findings were controversial at the time. They are now increasingly supported by a growing body of research in psychoneuroimmunology, the science of how mental and emotional states directly alter immune and nervous system function throughout the entire body. The question is not whether your pain is real. It is entirely real. The question is where it originally began. For many adults over 60, the accumulation is long. Losses that were never mourned because there was no time, or no permission, or no one who could hold that weight alongside them. Grief from decades ago that was filed away under the word strong, under the phrase "I am fine," under the silence of a generation that was taught that feelings were a private matter. They are not a private matter. They are a biological one. And the body, patient as it has been, is simply waiting for you to finally turn toward what it has been carrying on your behalf. If this video resonated with you, take a second and hit that like button. It helps more people find this content when they need it most. Subscribe so you never miss a new video, because every week we bring you research-backed insights to help you feel more like yourself again. And if you know someone who might need to hear this, a friend, a parent, a sibling, share it with them. Sometimes the most caring thing we can do is pass along the right words at the right moment. I'll see you in the next one.